So good afternoon, everyone. Today we have this session on policy reforms, what to expect in 2022 and beyond. So we all were, since years, I think countries made their programs for 2020. We had goals for 2020. And there was a long time chat about what will be there 2020 and beyond. And then came the COVID and poof, most of the goals were left in wonder, and it took us into a very reactive phase where we were responding to the pandemic in a very, very, knee-jerk way. So, but having learned from this, I think there will be a lot of changes that we will see post the pandemic, and that's what our discussion will be for today. So I'm Charu Gautam. I'm a medical doctor, and I work in the clinical research space. I'm based out of India, and with me I have a very esteemed panel, I'll ask them to briefly introduce themselves. Manuel, you could go for an introduction.
Yes, thank you very much, Dr. Shari. Nice to meet you, and it's a pleasure to be here with all of you. My name is Manuel Lavariega. I'm medical director for Home Health Medical Consulting in Mexico City. I am also a medical doctor. I'm a specialist in pharmaceutical medicine, and I'd be wondered to be here. Thank you.
Thank you, Manuel.
Hey, this is Sajeev Nair, and I've been a longevity researcher and also biohacker. So very passionate about the space of preventive health and wellness. I've been researching, writing on these topics. So that's about me. I'm from India.
Kaushik, please go ahead.
My name is Dr. Kaushik Sarkar. I'm Director of Institute for Malaria and Climate Solutions at Malaria No More. I've specialized in community medicine, business analytics, and artificial intelligence, all diverse domains in terms of the names. I work at the intersection of global health, technology, and data. Very nice to meet you all, and Charu, over to you.
Thank you so much, Kaushik. So as you can see, we have people from diverse backgrounds here. We have, people from wellness, from preventive health, from artificial intelligence, technology, as well as home health care, etc. So these are the things that are going to drive the healthcare forward. As we've seen in, in the pandemic area, we've seen that there's been a lot of changes in the way people are working. There have been different waves that have come in, the first wave, the second wave, the third wave, and now, we're seeing that there is a receding way of the pandemic. So Manuel, what do you think, is this the end of COVID, or is this the end of the pandemic, and what is your opinion will be the major long-term repercussions, especially on the healthcare?
Yes, this is a very important question. For the global perspective, of course, we have different waves in different parts of the world, in different countries of the world, related with the COVID pandemic situation. Of course, as you can hear in the news and also as you can see in your countries, the different countries have taken some perspective and some points of view related according to the manage of the pandemic issue. In this way, I think that nowadays we are having an endemic situation. Of course, the vaccines are very important to have the control of the pandemic condition. But of course, the basic points of protection are critical. The face mask, the clean environments, and also the safety distance between persons will be the critical point to avoid more infections.
Thanks, Manuel. I think you made a very important point that now it's almost an endemic, and therefore, it will be a lifestyle change that will be, taking care of hygiene, taking care of yourself, and taking that responsibility yourself. So, Sanjeev, in that, since you're in the wellness space, what is the biggest challenge that is being faced in the healthcare sector post the pandemic? And what do you think, is the preventive way to go about it?
So one good thing which has happened is people have become very conscious about their health. That's something which is very important. Even though, as health professionals, that's important, but as common people, we have never been that much conscious about health as we are right now. So if I talk from a common man's perspective, when it comes to hygiene or when it comes to wearing the mask or, all those aspects, everybody is very conscious about health, number one. Number two, people understood during this COVID wave that, this kind of waves can happen again. Only you can protect yourself. People have seen that it's not because of the coronavirus people died. It's primarily because some people couldn't withstand the attack of the coronavirus. So those people who had lifestyle diseases, especially type 2 diabetes and all, they had a major challenge. But same time, people who are healthy or who have been maintaining good health practices, even though they were also being affected by coronavirus, but at the same time, I don't think it really hit them hard. So I think the overall awareness about maintaining good health, preventing diseases to happen, all those consciousness level has gone up. As a researcher and as we have a research company, we are seeing it happening right in front of us. When we talk to people, common people, they are moving to health foods, healthy habits. Every aspect, if you look at it, even if you look at the way, during the lunchtime, if you had you observed that, people, those salad counters were emptying very fast. So this was not happening maybe 3 or 4 years back. So I think, of course, we had a definite tragedy during the last 3 years, but at the same time, we always believe that there is a chaos before every creativity. So considering that 2 or 3 years as a chaos, we can expect that there is something huge, creative thing is going to happen right now in the world, especially in the field of health and wellness. That's what I expect.
Thanks, Sanjeev. So you spoke about, the changing health habits of people, and that's what people are taking after being aware of this. But Kaushik, I have a question for you, because you are yourself in the preventive medicine and you are in the artificial intelligence as well. So what are the missing pieces that we felt were there in the global healthcare security agenda that led the countries down to their knees during the pandemic? So what are your recommendations for the long-term response? Rather than the knee-jerk reactions that we saw, people were just learning on the go and implementing whatever they could during the pandemic.
So, 2 questions. The answer of the first question will come from right where Sanjeev ended, related to, 2 years of chaos and post that coming to creativity. About 100 years back, there were 2 or 3 years of chaos. Spanish flu, over 500 million died, nearly 50 million, over 500 million infected, near 50 million deaths. And after 100 years, we are seeing a similar chaos. So what's the difference? The only difference that exists beyond the biology's, life sciences and other part is where the deaths are happening and where complicated cases are dying less. So that's what has been the advancement in terms of impact in the last 100 years. So that essentially means that apart from treating the complicated cases, global health, in spite of having a lot of advancement in technologies, drugs, vaccines, and so many stuff, we have not been able to be prepared for such a pandemic. So the missing piece here is that integration and technology transfer. If you look at global health security agenda's action packages, integration and technology transfer, these 2 elements are kind of missing in the overall framework. The second part is 3 critical elements are there. One is climate, second is human mobility, third is changing behavior. These 3 patterns are very, very critical when you are targeting any health security threat. But none of these pieces are being targeted as core, elements or pillars of action within those action packages of the global health security. So you need to act on that. Coming to the second question, knee-jerk reaction versus long-term response. You know, I was listening right from this morning, and I heard a lot of digital innovations and other stuff. Knee-jerk reaction is quickly adaptable digital therapeutics. We heard about evidence-based medicine. Let's bring digital therapeutics in, evidence-based medicine in, which is quickly adaptable. You will have a framework. Whenever a new disease comes in, you just put it into that framework, and that runs at scale. That's one. Similar knee-jerk reactions are like activation of innovative care models, be it remote care models, hybrid care models. There is 28.5% CAGR of telehealth, telemedicine. So these are the things that are booming industries, so you have to use that as skill. But long term, you need resilience. If your preparedness is not there, your system will suffer. The countries were brought down to their knees because they were not resilient to such threat. Over, and we'll add later maybe.
Yeah, I think you brought in good points. One was resilience. I think that's something which was being advised over and over by the leaders, you know, to have resilience, to have patience, to stay indoors, to go with the, you know, accept the pandemic. But I think that as a society, we need to build up. It's, of course, the policymakers will make their policies, but it becomes more of, you know, enforcement when it's a policy. And so this resilience as a society would probably come in, you know, with more of a culture, as it has to come up as a culture rather than, you know, as an enforcement. Also, we saw that a lot of technology took over in this period of 2 years. Education became online. Shopping became online, you know, what probably, and digital, which probably was vendors, especially in the lesser developed countries, were struggling. But in the 2 years, it took a major turn, and, you know, technology has taken over the retail and the sales for this, and it's also taken over education. We've been working from home for the last 2 years. So there have been many changes in terms of technology. But when we come to healthcare, there is still a major challenge, because the traditional system of healthcare has been to go to the health provider rather than health reaching the patient. So my question is to you, Sanjeev. You know, when we see that there's technology enabled for so many other things for healthcare, again, whether it can be provided to the underprivileged and underserved population. I'm aware that you're already working into technology, but, you know, generally technology is perceived to be more for the privileged. So how do you think, you know, this can be expanded in the future to take it to the lesser
this is I think a very important perspective, especially corporates or companies like ours. We always look at this, because when we look at most of the things which is advanced technology, there's a cost involved. And even though you wanted to consider this as a service, but still even to cover the cost, you need to price it. And what happens is that it becomes you know, accessible to a group of people. But to take this to the masses, take this to the underprivileged or whatever category we talk about, or economically deprived, definitely government will have to support, each and every government will have to support, and they will have to come out with their own the programs which can support it's almost like a private public participation kind of projects has to come up in this space in terms of digitization. Otherwise what happens is, of course, with the blockchain technology advancement, decentralization is going to be something which is quite exciting, where you know, it's not going to be in the future, it's not going to be in the hands of few people. That could have been a major, you know, tragedy, because especially when it comes to health data, and if digitization happened in a big way, and the data is getting completely, I would rather say, stored in you know, in specific sectors, then there could be, you know, in centralized way, there could have been a problem. But some or other, you know, everything, I always see that in the universe, everything happens in a balanced way. So at the same time, the blockchain technology came up, the private blocks where you can store your own health data, give access, whichever way you want to give access. So I think, but all these things, as you rightly said, this has to go to the masses, this has to go to the economically deprived classes only when government steps in and support the private sector, because government alone may not be able to do it. So it has to be a partnership between the governments and the private sector.
I think the vaccine, the way it was private-public, association, and the way the private companies also supported the vaccine distribution, especially in a large country like India, I think that was a good example that we could, in India, we could provide vaccines to the poorest of poor in a free manner. I think that was a good example set, and this could be taken forward. Kaushik, you are into technology, and so what technologies are already existing to enable a fail-safe response now and also when we look at the future in the long run?
So in terms of technologies, there are certain technologies which are currently existing or being tested and tried for the last 2 decades. And very generically, new molecules of drugs, vaccines, monoclonal antibodies, new tests, metagenomic studies and other stuff, they are being applied. But let's come to the enabling technologies. So, since morning we heard about a lot of wearables, monitoring devices, wellness tools. I call it companion solutions. The moment I said, that policies about the regulatory part and society has to build up the resilience part, so how to connect it? So enable and empower the people to take the decision about their health. And to enable that, you need companion solutions. The challenge right now is these companion solutions are not reaching to those who mostly need these type of solutions, who are vulnerable. There are monitoring tools, IOMTs, IoTs, and other stuff. There are tools even for mass-scale decision makings for policymakers, early warning systems, prediction and planning tools. These are simple tools. People need to have both decision makers, general public. It should be tailored and it should be made available to them. So some years back, there was a term which became very popular, citizen science approach, which I believe is still popular in UK. And similar stuff where people take their own decision based on the data that they generate. When we are talking about data, you have to give them some incentive why people will use data. So that's where the use of technology, blockchain, IoT, even new vaccine technologies, molecules, all will help. But the decision has to come from the user, not imposed by the policymakers.
Yeah, that is a very key point. Coming to this, that we're looking at both data as well as healthcare availability. So Manuel, what will be the most important issues that will shape the international healthcare agenda in 2022 and beyond?
This is very important because, as you know, the global policies have different change and different situations and also different environments around the world. I have here in my notes 10 points that I think that will be the common in all the world, but of course will be changed the history of this year. Of course, if you, my colleagues, have another option, feel free to comment about it. The first one is the economic recovery related with COVID-19. The second one is the geopolitical tension that nowadays we are living. The third is the prices around the world. The fourth are the health. The spread of the COVID shot health to the top of the international agenda. The fifth is the fears related with the pandemic and also with terrorism. The sixth is the leadership, who will be the leader in the world. The seven are the innovations around the world. The eight, the mobility of the population, the mobility of the people, and of course the mobility of the technologies. The ninth are the humanitarian crisis, And the last one is the climate emergency. All these 10 points are a critical key factors and also will be the main issues and the main points of the political and also with the health and the country's agendas for a lot of meetings. As you know, nowadays we are having the OTAN meeting, and all these points will be discussed with all the presidents that will attend this meeting.
Thanks, Manuel. So when we talk about health, like when you're talking about health policies for the future, I think you've touched upon a lot of other things like the geopolitical and the climate, etc. I think that's looking at the big picture, you know, that health alone does not stand alone. Health can impact all the other factors as well as all the other factors also impact the health you know, of an individual or of a country or then of this universe. So when we're talking about technologies that will enable the future in the long run, especially for health, what does the reform look like, or you know, for these technologies and the response strategies? Kaushik, I'll put this question for you.
So, reform essentially means, you know, there are innovations which are disruptive, and then there are innovations which are incremental. At times, innovations disrupt, but not always in the good sense. So I'll give a generic example for audience which are from health and non-medical background. You won't find an animal species which is bottle fed except for human being. Bottles were there to enable the mother to help the mother, but not replace breastfeeding. We introduced one innovation just to disrupt a natural practice which was for good health. Now, to bring innovations and reform, a few things are there. First of all, the climate piece, we need to climate-proof the global health solutions. Whatever we are doing today, with changing climate, those interventions has to work within the changing climate and environment, with growing population. So that's the resilient part. During planning, they need to be considered. The second part is epistemic institution. We are talking about data, but a program manager implementing a solution, sitting at an office in a village or a block, they don't understand data, they understand stories. So you have to convert the data into their language, the data storytelling part, so that they can make decisions. That's the second reform. Data literacy, data storytelling, and epistemic institution, bringing abstraction to reality. Third piece, workplace interventions. Although we are working from home right now, most of our time within the day we spend at the workplace. So let workplace be the area where health interventions are started, where health companions or companion solutions will be most effective, monitoring will be most effective for healthcare. And the last piece is, I heard the term metaverse this morning. So metaverse of health awareness. I think for the last 2 years, we ran at Malaria No More 2 massive awareness campaigns through social media and digital media, reaching over 150 million people. You know, these we could reach within weeks, within months to these many people, and we could see the impact through these type of technologies. So while increasing access of internet to people, we also need to ensure that we are making health as a core agenda item of the awareness part, of the discussion part, of the dialogue part. So that's the reform in my understanding.
I think in the long run, we're talking about the reforms, that need to be done both at the policymaker level, at the government level, then at the implementation level. And we also heard from Sanjeev that, there has to be wellness, and that has to be from within or from a self-motivated pattern. So Sanjeev, how would you think, what can be the changes that can happen in the future to make this more, personalized onto for the healthcare?
I think adding to what Dr. Kaushik was saying, when we talk about reforms or, the primary thing is that each and every individual has to be empowered to understand. They should know that they are responsible for their health. That's the most important thing. Because even now, the overall, a lot of people, I would rather say the masses, they still believe that when it comes to health, okay, as long as I don't have a disease, I am healthy. This is the concept people have. And when they are, maybe because of their own wrong lifestyles or bad lifestyle patterns, they contract with one or other disease, then the whole things, becomes problematic. So the key factor is people have to be educated that the key to good health is in their hand, number one. Number two is just like what technology is bringing onto the table, there should be mechanisms by which the healthcare professionals should adapt to those technologies. That's very, very important. The good old days are over now, if things are changed, especially when, you have a, pocket-size ECG available, which is anybody can use it at home, that also a 12-node medical grade, US FDA approved. So things are changing very fast. You have a ring which can actually give all the kinds of medical data or the health data. So now I think one area on which we see, because we work on technology, whether it is genomics or whether it is IoT, one area on which we see major challenges, even the health practitioners, the professionals, somehow or other, many of them have got resistance. They think that, oh, okay, this is not the way, we have been practicing this for years together. Especially Human Genome Project came only in 2003. We understand that, people who were educated before that must not have really learned about it. But maybe they have to unlearn, relearn. I think they have a major role to play, because I would rather say, whatever we say, how much of our empowerment we talk about in this world, ultimately, we as common people, we trust doctors, we believe in doctors, and we take their advice. So if they are not equipped, they don't know exactly what's going on, if they just persist, because I know there are cases where, they go to some senior doctor and they say, no, these are not required, because he doesn't know, that's the main problem. But now, the point is, the world is completely changing. It is no more the old 20-year-old back, the world has completely changed. So if the professionals, any field for that matter, especially in the healthcare, if we are not really getting equipped towards it, what all kinds of new devices are coming up? What is happening in the metaverse? Some people ask me, metaverse and health, what are you talking about? We have nothing to do with metaverse. I said, imagine in the coming years, the two sectors which are going to completely create breakthroughs are, one is healthcare and second is education, the metaverse. If something can happen, if even just I give some people simple example, yoga, meditation, all those things are good, people know, but it's boring. Some way. That's why people quit in between. Now, if I can give you an experience sitting at home, you're doing your yoga in Himalayas, and the next day you're doing your meditation in the Gold Coast, people will be excited to do that. That's going to happen in the metaverse. People are going to be treated in the metaverse. So if we don't adapt, we don't really, take the technology in our hand, I think a lot of people will become obsolete. So I think just like we common people are responsible for our health, I think the health professionals and practitioners have to be completely equipped for the new world.
So I can totally relate to what you said, because I work in the clinical research space, as I said earlier. So, when we work on vaccines, it usually takes us 6 to 8 years to bring it to the market. And we've seen what happened in the last 2 years. We have so many successful vaccines, and it was possible because technology was used, there was simulation data done, there was a lot of data analysis done, there was, artificial intelligence applied to see what could be, if on such a sample size, this is what appears, what could happen, with the past data in place. So I think a lot of technology and a lot of human intelligence to combine together, artificial and human, brought to us, these vaccines earlier, and I have been a part of several vaccine development programs. So I did see how fast it was and how much we had to adapt to it, and it was the need of the hour, and that's why we were able to do it. But I think you just said it that, everybody needs to get geared up to it. We don't need to wait for a pandemic to become, to get adaptive to the technology and the faster access to healthcare. So my next question is to Manuel. So while we're talking of COVID, we all saw what a great equalizer COVID was. It spared no one, no country, no human. It was just an equalizer. So however, accessibility to healthcare differs between the nations and between social classes. So what, in your opinion, is health equity, and why does it matter to business as well?
Yes, this is a critical success factor that we always have in mind. The equality is a very important point because, as you are mentioning, vaccines are synonym of opportunity. Vaccines are synonym of universality. In this way, I think that this important point that it's equality have a very important weight around the world. In this way, as my colleague mentions, some technologies activities, some research activities, and also education activities will need to be open around the world to be more effective and also to be more active as society. In this way, I think that this term nowadays have a really big weight to open opportunity around the world.
Thanks, Manuel. So from these discussions, I think we've come to important points about the future policies, which will be, as we see, focused on the use of artificial intelligence, use of technology in data. We are hearing about metaverse and high-level technology that will help person individualize their health and bring health into their own hands. We also know about the way that medicine is going to be more personalized in the future. So these are some of the takeaways from today's session. I'll take a pause here, and if there are any questions to the panelists, I'll welcome that. Okay, since there are no questions, we can close the session.
Thank you so much.
Thank you.
Thank you, everyone. Thank you so much.
All right, thank you to our panelists, and thank you, Dr. Charu, for moderating the conversation. Oh, yeah. Fantastic, thank you.